There's one small piece of anatomy, about the size of a walnut, tucked away where you've never thought about it, that explains nearly every bathroom complaint men start having in their 60s. The slow stream. Waking up at night. The feeling that you never quite finish. Almost all of it traces back to a single physical fact most men have never been told. And once you understand that one fact, two things happen. The symptoms stop feeling mysterious and frightening, and you suddenly know which ones are just normal aging and which ones actually deserve a phone call to your doctor. So that's what I want to give you today, that one fact and everything that flows from it. There's no fear-mongering here, no miracle products, no sales pitch at the end. Just a clear picture so you can stop worrying about the normal stuff and pay attention to what actually matters. One thing to be clear about up front, because it matters. I'm not your doctor, and this is general information rather than advice for your particular situation. Treat it as the background that helps you ask sharper questions at your next checkup. Here it is. The tube that carries urine out of your body, the urethra, runs directly through the middle of your prostate gland. Straight through the center of it, like a drinking straw passing through the middle of a walnut. That's it. That's the whole key. Hold that single image in your mind because everything else in this video is just a consequence of it. Your prostate, by the way, isn't some vital organ like your heart or your kidneys. Its main job is producing part of the fluid that makes up semen. It's a reproductive gland, and for most of your life, it sits there quietly doing that job and nothing else. You never feel it, never think about it. The reason it eventually causes trouble has nothing to do with the gland failing, and everything to do with where it sits, wrapped around that tube. Because here's what happens with age. For most men, the prostate slowly grows. Not overnight, gradually, across decades. By the time a man reaches his 60s or 70s, that walnut may be noticeably larger than it once was. Now go back to our image. If the gland is growing and the urine tube runs straight through it, what does a bigger gland do to that tube? It gently squeezes it, like a hand slowly closing around a garden hose. And watch how that one squeeze explains every single thing men in this age group notice. The stream gets weaker because the hose is being pinched, so less can flow through. You have to wait a few seconds for things to get going because it takes a moment to push past the narrowing. You feel like you didn't fully empty because some urine stays behind the squeeze. And then the bladder, which is a muscle, has to work harder to force urine past that pinch. So it gets thicker and more sensitive, and a more sensitive bladder tells you it's full sooner and more often, including several times a night. Every one of those symptoms, the weak stream, the hesitation, the frequency, the night trips, the not quite done feeling, is the same single fact playing out. One gland, slowly growing, in a spot with no room to spare. That's the cascade. And I hope you can feel how much less scary it gets once you see it as plumbing rather than as your body breaking down. This common enlargement has a medical name, and I want to say it out loud because the name sounds far more alarming than the thing itself. Benign prostatic hyperplasia. Doctors shorten it to BPH. Let me translate it because the words are scary. Benign means not cancer. Hyperplasia just means the tissue grew by adding more cells. So the whole intimidating phrase literally means the prostate got bigger and it isn't cancer. That's the diagnosis behind most of what we just described. It's one of the most common conditions in older men, and on its own, it is not dangerous. It's so common that it's essentially considered a normal part of male aging. So if a doctor ever tells you that you have BPH, I don't want you walking out of that office frightened. You now know exactly what it means and exactly why it's happening. Now, our one fact is powerful, but I'd be doing you a disservice if I let you think it explains everything. It explains the routine stuff beautifully. There's a specific short list of symptoms it does not explain, and those are exactly the ones that mean you should stop watching reassuring videos and pick up the phone. So here's the honest line. The squeeze explains a slower stream, going more often, getting up once or twice at night, taking a moment to start. Annoying, common, usually not urgent. What the squeeze does not explain, and what deserves a prompt call to your doctor, is blood in your urine or your semen, pain or burning when you go, being completely unable to urinate at all, fever alongside urinary symptoms, unexplained weight loss, or new bone pain, especially low in your back or hips. None of those is just the plumbing. I'm not listing them to frighten you. I'm listing them so you know precisely where the line sits, because knowing the line is exactly what lets you relax about everything on the normal side of it. And there's one more limit to our one fact, and it's the important one. The mechanism cannot tell you the difference between a harmless enlarged prostate and prostate cancer. Because, and this is the part men don't expect, The two can feel exactly the same from the inside. A bigger prostate does not mean cancer, but you genuinely cannot tell them apart by how you feel, because the symptoms overlap almost completely. That's not a reason to panic. It's simply the reason the conversation with your doctor exists, because that conversation is the only thing that can actually sort it out, and your own body can't. Which brings us to screening, and I want to give you the real picture here, not the scary version. You've probably heard of the PSA test, a simple blood test measuring a protein the prostate makes. Higher levels can be linked to prostate problems, including cancer. Sounds like you just test everyone, right? It turns out to be more complicated, because that same protein goes up for harmless reasons too, including the very enlargement we've been talking about. So a high number doesn't necessarily mean cancer, and chasing everyone can lead to procedures some men never needed. At the same time, the test does catch some aggressive cancers early, when they're most treatable. It's a real tool, just not a perfect one. That's why the major medical groups land on the same advice, and I want you to hear it clearly. For most men, this is a shared decision you make together with your doctor, not a blanket yes or no. For men roughly in the 55 to 69 range, that individual conversation is the recommended approach. For men 70 and older, routine screening generally isn't recommended without specific reasons or symptoms. And men at higher risk, a family history of prostate cancer, or black men who face higher rates, often have good reason to start those conversations earlier. Notice what I'm not doing. I'm not telling you to get the test or to skip it. I genuinely can't make that call from a video, and you should be wary of anyone who tries. I'm telling you it's a real, worthwhile conversation to walk into. So what can you actually do? Here's the nice part. Once you understand the one fact, the genuinely useful steps make obvious sense because they work with the mechanism instead of promising to magically reverse it. Remember, a lot of the nighttime trouble comes from a bladder that's already working harder and more sensitive. So anything that loads that bladder less helps. Easing off fluids in the couple of hours before bed. Going easy on alcohol and caffeine in the evening, since both make you produce more urine and irritate the bladder. Taking your time and fully relaxing when you go. None of that shrinks your prostate, but it genuinely takes the edge off the daily nuisance, and now you can see exactly why it works. Then the general habits. Regular activity, keeping your weight in a healthy range, not smoking, and a sensible diet leaning toward vegetables, fruit, whole grains, and healthy fats. I'll be honest about the strength of that evidence. These are good bets for your overall health with reasonable links to prostate health, not a guaranteed fix for symptoms. They're worth doing because they're good for you broadly. That's a more honest reason than any miracle claim. A quick word on supplements, since you've seen them advertised endlessly. The popular ones, saw palmetto is the famous example, have generally underwhelmed in better quality research, often not beating a placebo. That doesn't make them dangerous for most men, but don't spend money expecting a cure, and never let a supplement become your reason to avoid getting real symptoms checked. And one genuine safety point. Some supplements can interfere with medications or even affect that PSA test, muddying your results, so tell your doctor about anything you're taking. That's not a formality, it changes your care. And the part I most want you to hold on to. There are real, effective medical treatments for bothersome prostate symptoms, actual medications that relax the gland or reduce its size, and more options beyond that, all prescribed and monitored by a doctor. The reason I point you to your doctor instead of a bottle off a shelf isn't caution for its own sake. It's that the real treatments actually work, and they're available to you. Let me slow things down, because for some men, anything involving the prostate carries a quiet fear. Maybe you knew someone who went through prostate cancer. Maybe you've been avoiding a checkup precisely because you're afraid of what you'll hear. So plainly, for the large majority of men, these age-related prostate changes are manageable, treatable, and not a threat to your life. And even when screening does turn something up, prostate cancer is frequently slow-growing and very treatable, especially in a man who's stayed in touch with his doctor. The most useful thing you can do is the least dramatic one. Don't disappear from your doctor's office for years because you're nervous. Avoiding the appointment doesn't make you safer. It just means decisions get made later with less information. You're allowed to take this seriously without being afraid of it. So let's come back to where we started. One small gland, the size of a walnut, with your urine tube running straight through the middle of it. That single fact explains the slow stream, the nighttime trips, the hesitation, the feeling of never quite finishing, and it tells you those things are usually just normal aging. It also tells you exactly where its explanation runs out. The short list of symptoms that deserve a real doctor's visit, And the cancer question that no feeling in your body can answer on its own, only a conversation can. Hold on to that one image, and most of the fear around this topic simply dissolves into understanding. One last reminder, and I mean it sincerely, always talk with your own doctor before making any major change to your diet, your medications, or your supplements, and before deciding anything about screening. What's right for the next man may not be right for you, and only someone who knows your full picture can help you weigh it. Before you head off, I've got a question I actually want answered. Before today, had anyone ever explained to you why these changes happen? Drop it in the comments. I read them and they decide what I make next. If this made the whole subject feel less frightening, a like helps another man stumble onto it instead of the usual scare stories. And the natural follow-up is my video on what really happens to testosterone as you age, cut from the same honest cloth. It's linked below if you want it.